Okay, thank you very much, Yanni. Today I'm going to be talking about an online mood chart that's based on the NIMH Life Chart developed by Bob Post and addressing three questions. First of all, what are the advantages of longitudinal mood charting in both clinical practice and research? How can an online version help with adherence? And how can engagement in the charting task be leveraged to deliver a simple therapeutic intervention? So let me start out with some of the clinical issues. Bipolar disorder is a complex illness, and comprehensive evaluation requires a large amount of data. First of all, for a patient with mood instability, their mood can vary on a day-to-day basis. But it's even more complex than that because there are many elements that go into determining what that variability is going to look like. And these include endogenous cycling, environmental stress, as might be seen in relationships and work, medication effects, sleep, as well as other things. But when we do a clinical evaluation, oftentimes we don't have time to go into all of that, and a patient frequently will not remember all of the day-to-day variation and all of the things that were associated with it. I had a patient who became manic, and when I asked her what was happening around the time you became manic, she said nothing at all, whereas her partner was able to tell me that she went in for a colonoscopy the day before, and it was extremely distressing to her. So it's difficult for clinicians to have all the data they need to make the best treatment decisions. Here is one possible solution to that, and this is the NIMH Life Chart methodology, which many of you may be familiar with. This was developed by Bob Post at the National Institute on Mental Health in the United States, and as you can see, the bulk of this is devoted to recording moods, and we have mania and depression, mild, moderate, and severe. One can also put in other things such as sleep and life events, and also, there's not room on this slide, but also it shows medication as well. And this kind of thing will give a clinician and a patient a very clear history of not only what happened, but what the relationship was to the mood, the life events, and the medication. So not only does it give a large amount of data, but it gives the data in a pictorial fashion. And one advantage of being able to see things as a picture is that relationships among variables can become more clear. Bob Post said that one of the things this led to was the finding that when someone is responding well to lithium, stops the lithium, and then goes back on it, their second response is often not as good as the first. And he said that came out of life charting. Now, there are also ramifications for research. This is a quotation from Joseph Goldberg, who said, "Longitudinal mood instability is the quintessential feature of bipolar disorder, but most studies measure cross-sectional symptoms." This is some results from a study by Parker et al., in which a mood stabilizer was compared to a placebo. And they used two kinds of measures. They used these traditional cross-sectional symptom measures, and they used a life chart. Now, the cross-sectional symptom measures, such as the Hamilton Depression Scale, the Young Mania Rating Scale, and others, typically look at the past 7 days of an individual's life. So essentially what it's doing is it's compressing 7 days into one single measurement. And there's different ways to do this compression. One can take an average of the symptoms, one can take the most severe symptomatology in that 7 days, or some other way determined by the study. But by doing that, one loses a great deal of this mood instability. It's as if one were throwing away data. So what they found was that in this particular study, none of these measures was able to separate the active drug from placebo, but the life chart did. And the reason is that the life chart measured severity, duration, and frequency of mood episodes. And this is really what bipolar disorder is about. The big challenge, however, with using a life chart is the amount of work that it requires. To get patients to rate consistently on a daily basis is almost impossible. And when a clinician uses it or when a researcher uses it, it requires an enormous amount of time to sit down with the patient and go over day by day and fill in all of the missing values. And in a typical clinical environment, and even in many research environments, this is simply not possible. So the question is there anything that can be done to make adherence easier and potentially make this tool more broadly available? So the question is, how can charting adherence be improved? Dr. Fred Goodwin and I have been working on an online adaptation of the MoodChart. And so what is it about an online adaptation that can potentially help to improve adherence? Well, simply being able to access the chart in a web browser is not necessarily any easier than writing down mood on a piece of paper. What we did that we think is the important step is that we made email into the primary rating interface. This is an example of an email that's automatically sent out once a day to participants in this study. And essentially what it is a series of links. And we call this one-click mood chart. Because in order to chart mood, all a person has to do is open up this email and make a single click. Because embedded within these links is something like this. And just focus on this question mark here. To the left of the question mark is the web address of the page that will capture the click. To the right of the question mark is a small amount of data that's automatically sent to the server. D=3 shows that they clicked on severe depression. PC is the participant code, and then we have the date. So the server knows who's rating, what date is being rating, and what the rating is. And this allows the rating to be recorded with just one click. Why is it that email is a particularly effective way to increase adherence? And the reason is that for many of us, I should probably say, email checking can be compulsive. This is a survey that was done at a university of faculty and students, and they simply asked them, how often do you check your email? And as you can see, there's a nice bimodal distribution. People on the right who you may want to call the healthy people are checking it every few hours or less, and people all the way on the left are checking it every 15 minutes or more, both representing about a third of the sample. And to answer the question of why this is, we simply go back to B.F. Skinner. Like slot machines, email checking follows a variable interval reinforcement schedule, which creates a steady rate of response. And in fact, the variable interval reinforcement schedule creates the most steady rate of response. And the reason why emails are like slot machines is that most are mundane, but occasionally and unpredictably, one arrives that's novel, important, and rewarding. This is the web page that opens in response to the email click, and it tells the participant that they're done. And they can simply go ahead and delete the email, but there's also an opportunity to enter additional information. Participants can rate both above and below, normal to indicate a mixed day or an intraday cycling. They can rate sleep and other clinical variables as well. Here's an example of the chart. Because this contains personal information, users need to sign in to see this, and you can see there's the mood, monthly weight, sleep, irritability, anxiety, medication, and also one can journal notes.